Welcome everybody to our Tuesday Stroke Survivor Support Group meeting. We have Dr. Bruce Hetzler here for the fourth time. What can I say about Dr. Hetzler except I love his presentations and his willingness to share his knowledge with us. So today he's going to talk about language and the brain. In looking through his PowerPoint, I realized I don't know, like most of the subjects he's presented on here, I don't know about as much about this as I should. Ooh. Anyway, I'm going to turn it over to Dr. Hetzler now.
Thank you, Ralph. As you said, I've presented here 3 previous times, and now that the resulting restraining order has expired, I'm happy to be back. So, today I will talk about language and the brain. Here are the topics we'll deal with: Broca's aphasia, Wernicke's aphasia, conduction aphasia, global aphasia, Alexia with agraphia, pure Alexia,
Sorry, I'm not sure.
Prosody, a component of the right hemisphere, and phonagnosia, Prosopagnosia, the aprosodias, and that'll be the end.
I told you I had a lot to learn.
So here we go. We'll start by defining a cerebrovascular accident. That's brain damage caused by occlusion or rupture of a blood vessel in the brain. Aphasia is a difficulty in producing or comprehending speech not produced by deafness or motor deficits. Aphasia is an impairment of language that can affect both the production and comprehension of speech and impair a person's ability to read and or write. Aphasia is always caused by injury to the brain. Stroke is the most common cause of brain injury that leads to aphasia, but head trauma, infections, or tumors can also cause aphasia. Aphasia can be mild or only affect a single aspect of language, or can be so severe that it's incredibly difficult to communicate with the patient. Most commonly, multiple aspects of communication are impaired. Some people can recover from aphasia, but if they have it longer than 2 or 3 months, it is very difficult to recover. Now this shows a cross-section of a human brain, and I point this out to show you that a groove in the brain is called a sulcus, so a large one is called a fissure, and a bump is a gyrus. Some or all gyruses, actually gyri, have names, and that will come into play in a while. The top of the brain is the dorsal part, the bottom is the ventral. We'll begin by talking about Broca's aphasia, which is associated with damage to Broca's area. Now, Ralph, what important event occurred in 1861? Look at the lower left-hand side of this slide. You know what happened?
He might have left his brain to science because they were interested in him.
Well, Tan, Broca's patient Tan, died on April 17th, 1861. Now, Tan was not his real name, but Broca called him Tan because beginning at age 30, Tan could only say the word tan. Sometimes he would say it twice, tan, tan. And Broca had, and was like that from 1840 until his death in 1861. What did his death allow Broca to do?
Probably look at his brain.
Exactly. Up until that time, Broca was singing the song, "If I Only Had a Brain," because he had no idea what was causing the problem. And when Ten died in 1861, Broca could examine his brain. Broca did not slice it up, but rather looked at it externally and found a major problem in an area of the brain now called Broca's area. Now, in 1861, I was just a second-year graduate student, and I can still remember Broca coming into the neuroanatomy lecture hall at Northwestern University Medical School and talking about his patient, Chan. Now, Broca was difficult to understand because he was talking in French, but I got the idea. And here you see pictures that were taken of Tan's brain.
Pretty early
And
for
you can
that
see
quality
the
of
lesion.
photography.
Well, there was photography back then. There were pictures taken of the Civil War. They didn't have photography at the time.
Yeah, but there were daguerreotypes and silver plates. It wasn't as simple as it is today. Anyway, didn't mean to.
Anyway, so that area is now called Broca's area. And this slide shows Broca's area at the bottom of the frontal lobe. It also shows Wernicke's area, which we will get to in a little while. And here again is the left hemisphere of the brain. Here's the frontal lobe. Broca's area is here in this light blue part. It's just anterior in front of the primary motor cortex. So the facial area of the primary motor cortex is here at the bottom of the frontal lobe. Here's the parietal lobe that controls the somatosensory systems. At the back, here's the occipital lobe controlling vision. And down here is the temporal lobe. It is in the temporal lobe that Wernicke's area is located, which we will get to in a little while. Now, damage to Broca's area. Does this cause language problems because of paralysis of facial muscles? No, because direct damage to the motor cortex area that controls facial muscles only causes a very mild weakness of the lower portion of the face. That's because these facial muscles that control the mouth are controlled by both sides of the brain. So it has to be in Broca's area, which is just anterior to the facial part of the motor cortex. In 1865, Broca reported that damage to the left hemisphere caused language problems, but right hemisphere damage does not. Now, Broca's aphasia is a non-fluent aphasia. It's what you might call telegraphic. That is, an early telegraph would leave out interconnecting words like if, and, but. It's almost impossible for a person with Broca's aphasia to say no ifs, ands, or buts. They just can't say it. People with Broca's aphasia may be only able to say a single or a few words. In fact, there was one case of a minister's wife with Broca's aphasia who could only say two words, hello and damn it. That's all she could say. So people with Broca's aphasia have severely reduced speech, often limited to a few words. With a limited vocabulary, they have a difficulty in writing, but they can read and understand speech. Now, who is this? Can anyone tell me?
That singer, Travis,
Yeah,
Randy Travis,
Randy Travis, why is his picture included here?
because he had a stroke and he has aphasia.
Very good. Randy Travis experienced a stroke in 2013 that left him unable to speak or move without assistance.
Hmm.
He spent 2.5 years in daily therapy to regain the ability to do basic tasks. So he has severe Broca's aphasia, but he can still sing a few words at a time.
I met a minister one time that could not speak a word, but he could sing beautifully, and he had never particularly sung before. When I heard that, I wanted to know what he did every Sunday in church when the choir sang, but that was the story I was told. He couldn't say a word, but he could sing beautifully, and all the words just came out.
And that is not uncommon. Jan and Dean were a rock group that were contemporaries of the early Beach Boys. Jan and Dean had a couple of hits, including Little Old Lady from Pasadena
Mm-hmm.
and Dead Man's Curve. Jan was in an automobile accident in which his left frontal lobe was damaged. So the right side of his body was paralyzed and he had severe Broca's aphasia, but he could still sing fluently. And that's because singing is produced by the right hemisphere.
I suspect
Now,
we'll get to that.
I don't really talk about any therapy here, but I'll just mention briefly that there is a new study from Finland that was just published this year in the journal eNeuro. And what these researchers in Finland did was take patients that just had developed Broca's aphasia, and they divided them into one of three groups. One group listened to vocal music of the genre that they preferred, like opera or country music or rock or whatever, for an hour a day for 2 months. Another group heard instrumental music an hour a day for 2 months. And the third group heard speech, basically audio books, for an hour a day for 2 months. A month after that, they gave them all a test of their ability to talk and used magnetic resonance imaging to look at the fiber pathways in their frontal lobe. Only the group that listened to the vocal music for 2 months regained the ability to talk, and they had stronger axon pathways in their frontal lobe. So this now seems to be a new, excellent way to treat people with Broca's aphasia. But again, it was only done immediately after their stroke. No one knows what would be the result if people listen to vocal music, say, 5 years after their stroke. Okay, I'll be quiet about that.
Music therapy.
Yes. So now, Wernicke's aphasia is another type of aphasia. It involves impaired reading and writing, an inability to grasp the meaning of spoken words, an inability to produce sentences that hang together, and the intrusion of irrelevant words. So basically, in Wernicke's aphasia, you have damage to the middle and posterior portion of the superior temporal gyrus of the left hemisphere. You're probably wondering, well, where is that? Well, here's the left hemisphere of the brain. Every gyrus has a name. Here's the middle temporal gyrus of the left hemisphere. And damage there produces Wernicke's aphasia, which is a fluent aphasia, but the people have meaningless speech. So their speech is fluent, but meaningless, much like that of a politician.
You ever listen to Mr. Double Talk?
Don't think so.
He's a motivational speaker, and he does quite a good job with the whole thing about double talk and
So
such. Anyway,
here again is where Broca's area is. Here is Wernicke's area. Now, Broca's area is up here. Wernicke's area is here. Now, this shows the pathways used to speak a heard word. So the hearing information goes here to the primary auditory cortex, the temporal lobe. From there, it goes to Wernicke's area. It crosses over the arcuate fasciculus, which is an axon pathway, to Broca's area, and Broca's area controls the primary motor cortex to make you talk. This is speaking a written word. The back here, you see a word in the primary visual cortex. It then goes to the angular gyrus, which is an interface between vision and hearing, where it's converted to an auditory form. Information then goes from there to Wernicke's area, where it's understood, crosses over the arcuate fasciculus to Broca's area, and that controls primary motor cortex, allowing you to talk. So let's talk about the arcuate fasciculus. That's an axon pathway that goes from Wernicke's area to Broca's area. If it's damaged, it causes a problem called conduction aphasia. The symptoms of conduction aphasia include intact auditory comprehension, fluent speech, but it's paraphasic. That is, you may have added words or meaningless words. They have a lot of problem repeating what they hear. They can't repeat. They're more likely to come up with a definition than a word. So if you ask them to repeat 3/4, they might say 75 cents. They'll come up with a definition rather than a direct repetition. And conduction aphasia, again, caused by damage to the arcuate fasciculus. And this shows a lesion that can cause conduction aphasia. And again, here's Broca's area in the frontal lobe, Wernicke's area in the temporal lobe. This is the angular gyrus, and the arcuate fasciculus interconnects Wernicke's and Broca's area. In 2005, a study was done by Catani et al. They used a sophisticated type of MRI called diffusion tensor MRI and found that the arcuate fasciculus actually involves 2 parallel pathways in the brain, not just one. First, there's the classical arcuate fasciculus that's deeper in the brain. It's a long direct pathway used in automatic repetition. When you hear something and repeat it, when you hear something and repeat it, when you hear something and repeat it, you're using that pathway. And there is a superficial indirect pathway that is closer to the surface of the brain. It has 2 segments. First goes from Wernicke's area to the inferior parietal cortex, where there's a synapse, and it goes from the inferior parietal cortex to Broca's area. And this pathway is used in understanding auditory things. Damage to this pathway should spare the ability to repeat speech, but impair comprehension. You have difficulty understanding, but you can repeat because this other pathway is still intact. And this shows their results. This shows that indirect pathway from Wernicke's area up to the parietal lobe, where there's a synapse, and the other one from the parietal lobe to Broca's area. There'll be a test on this, so be sure you can draw it.
I can draw it, I just won't be able to spell all the words.
Oh, okay. Then there's global aphasia or total aphasia. And this is caused by lesions, that is typically strokes, that destroy the entire perisylvian region of the left hemisphere. Perisylvian means around the sylvian fissure. And I'll show you in a minute what I mean by that. So this affects both Broca's and Wernicke's area. These people cannot speak or comprehend language. Results from a stroke or blockage of the middle cerebral artery of the left hemisphere. Now this is the right hemisphere on top, but still shows the point. This is the sylvian fissure here. And here's the artery in red. When that's damaged, that takes blood away from all the area around it. That is the perisylvian area around the sylvian fissure. And that includes Broca's area up here in the frontal lobe and Wernicke's area down here in the temporal lobe. Is that clear?
Yep.
Okay, now, this is the left hemisphere again. Here we have Broca's area, Wernicke's area. Back here you have the angular gyrus. In 1891, Joseph Desjardins described Alexia with agraphia, inability to read, Alexia, inability to write, agraphia. And in his patient, that was caused by a lesion in the angular gyrus. In 1892, Desjardins described pure Alexia, that is, Alexia without agraphia. The person could not read, but could still write. It was caused by a lesion in the visual cortex of the left hemisphere occipital lobe and in the splenium of the corpus callosum. And I'll show you a diagram here that explains what I'm talking about. So this person could write, but could not read what he had written. He had blindness in his right visual field and left field Alexia. So, the bottom here, we are looking down on top of the brain. There's damage here at the back of the occipital lobe on the left-hand side of the brain. That caused the inability to see anything in the right visual field. There's also damage to the splenium of the corpus callosum. The corpus callosum is the band of axons that interconnect the two hemispheres. And the splenium, or back of the corpus callosum, allows for transfer of information from the right visual cortex to the left side of the brain, and therefore get to the angular gyrus and Wernicke's area where it's understood. And since that visual information cannot cross over here, the person cannot understand anything in the left visual field. So they're blind in the first person was blind in the right visual field and could not understand anything that he saw in the left visual field. And this shows the corpus callosum. The front is called the genu of the corpus callosum. The body is the middle, and the splenium is at the back. So in that patient I talked about, it was the splenium, or back of the corpus callosum, that was damaged. Okay, now we'll talk a bit about the right hemisphere and phonagnosia. Some people have localized brain damage that makes it difficult for them to recognize voices. This is a disorder known as phonagnosia. That is, you can recognize who I am because you recognize my voice. But some types of damage in the right hemisphere cause this phonagnosia, where you can't recognize me by my voice, but if you see me, you would recognize who I am. All cases of acquired phonagnosia show damage in the right hemisphere, either in the parietal lobe or the anterior superior temporal lobe. The parietal, this is the left hemisphere, but the point is, in the right hemisphere, it would develop damage to the parietal lobe or the anterior temporal lobe, but again, it would be in the right hemisphere. Okay?
Yep.
Now, there is almost exactly the opposite condition called prosopagnosia. The British neurologist Oliver Sacks wrote about a case of this in his book, The Man Who Mistook His Wife for a Hat. And this condition involves an inability to recognize the faces of people. So in the case, the man who mistook his wife for a hat, the man would try to lift up, well, he'd hold his wife's head by her hair and pick it up thinking it was a hat. And when she started yelling at him, then he realized who it was and stopped.
My cousin had a stroke about a year after mine, and he has that. Apparently, he couldn't recognize his own family. Apparently, from my understanding, there's 6 centers in the back, and he had several of them wiped out, and he participated in some kind of study where they trained him to use the undamaged ones to make up for the ones that were damaged. He also had a lot of trouble like doing things like reading maps.
Yes. Map reading is typically impaired by strokes in the right hemisphere.
That's what he had. And that's a language issue.
Well,
Sort of related.
no, it's not really language. It's more orientation and things like that, because map reading is a right hemisphere ability, as is, say, using blocks to duplicate a design. You can't do that following right hemisphere damage. So it's not really language, it's more orientation in space.
Gotcha.
Now, prosopagnosia results from impairment of the right fusiform gyrus. I'll show you a picture of that in a minute. Prosopagnosia can result from stroke, traumatic brain injury, or a neurodegenerative disease like Alzheimer's disease. This shows the underside or the ventral side of the brain. So the right hemisphere is over here on the left hemisphere on the right. Okay, this is the fusiform gyrus on the underside of the right hemisphere. And here's the facial region. And when that's damaged, you have prosopagnosia. Okay?
Mm-hmm. Looks like they're on both sides.
Now we'll talk about prosody. This is a right hemisphere function. Now, prosody is the melody of speech. For example, we'll take the simple sentence, I am going to the movie. a simple declarative sentence. Now, Ralph, I want you to say the same thing with the same words, but as a question.
Am I going to the movies?
No, you say, again, I am going to the movie.
Oh, okay.
Say it as a question.
Okay. I'm going to the movies?
Okay, his prosody was different. Now, his ability to produce that difference is a motor aspect of prosody. The ability to understand the difference is a sensory aspect of prosody. See the difference?
Hmm.
So prosody is the rhythmic, emphatic, and melodic aspects of speech. It's a right hemisphere function. It's normal in Wernicke's aphasia, but destroyed in Broca's aphasia. In 1981, Ross described the aprosodias and pointed out that the affective components of language are a dominant function of the right hemisphere. And he pointed out that the organization of this prosody in the right hemisphere mirrors the organization of propositional language in the left hemisphere. So in the left hemisphere, the ability to talk is caused by Broca's area in the left frontal lobe. The ability to produce differences in prosody are caused by the frontal lobe of the right hemisphere. The ability to understand the meaning of speech is caused by Wernicke's area in the left temporal lobe. The ability to understand differences in prosody is caused by an area that's the mirror image of Wernicke's area, but in the right hemisphere temporal lobe. And this shows functional MRI scans of the left hemisphere and right hemisphere while participants listen to normal speech, showing the blue and green regions here in the left hemisphere, or the prosodic elements of speech within a meaningful language removed. So the prosody activates the right hemisphere, while the language activates the left hemisphere. Follow that?
Yep.
Okay. Okay, in Ross's study, he had 10 right-handed patients with focal lesions in the right hemisphere and disorders of affective language. Observation made about each patient's spontaneous prosody, prosodic repetition, that is the ability to duplicate, prosodic comprehension, and comprehension of emotional gesturing. And he described motor aprosodia, where there was a problem in the right inferior frontal lobe that affected repetition and spontaneous prosody, but the ability to comprehend prosody and emotional gesturing were intact. So this was a motor problem, producing differences in prosody. And again, this is a mirror image of where Broca's area is in the left hemisphere. And then sensory aprosodia involve problems in the right posterior superior temporal lobe and inferior parietal lobe. Now, in this case, the person could produce differences in spontaneous prosody and gesturing, but there was a problem in understanding the meaning of prosodic differences or emotional gestures. If someone gave them the finger, they wouldn't understand it, in other words. Any questions on that? Okay, and this is the right hemisphere and prosodic
Mm-hmm.
ability to produce prosody caused by neurons here, and the ability to understand caused by neurons here in the temporal lobe. Okay, suggested readings, Stronger After Stroke. I still think that's an excellent book on any aspect of stroke. If you want to know about language in the brain, there was a book by that title published in 1999. Some of the chapters are a little difficult, but some of them are fairly easy to comprehend. So that is the end of my presentation today. I thank you all for attending, and I'll be happy to entertain any questions you might have.
Earlier, you said in the back of the brain, in the left side between where the part of your brain that your eyes report to, that it converted. It sounded like it was converting like what you read to a speech type of information for
Yes,
your
you're talking
brain.
about the angular gyrus.
Right.
The angular gyrus is in between the primary visual cortex at the back of the brain and Wernicke's area. So if you're going to understand what you read, you have to convert it from a visual form to an auditory form. And that is done by the angular gyrus.
Right. And I can't remember that name, but I could draw a picture of the brain and get accurately where it was because I saw that visually. That's just the way my brain works. So it sounds like that the internal processing of a lot of the what we read is actually converted to some type of auditory signals or
Exactly. Yes. If you're going to understand what you read, it has to be converted from a visual form to an auditory form. And that is done by the angular gyrus.
Interesting.
And if you're going to write down what you hear, it has to be converted from an auditory form to a visual form. And that again is done by the angular gyrus.
Well, it's interesting because I've met a number of people with aphasia, and they always seem to have different symptoms. Of course, I've met several people with Broca's aphasia, and which I believe is the most common, and they typically present the same. But I had a neighbor who had a stroke right after mine, and he could understand anything he said, but he couldn't talk, and he could read anything written, but he couldn't write. That seemed an odd combination to me. I've met a number of other folks who had, one of these and one of those, kind of a mix and match.
Yes, it depends on exactly what circuits in that area are damaged.
Right. Yeah. I was going to say mix and match to me because I don't understand. Well, I'm starting to how all this works together. And yeah. So what you're saying is like the guy that could comprehend but not talk and read but not write, he may have had damage to a couple of areas to in order for that to happen, and not having severe enough damage that it like wiped out his ability in one area, say that it wiped out his ability to both understand and talk.
That is correct.
With understanding.
Yes.
It's terrible. People kind of trapped in their brains. I had two stroke survivors describe Broca's aphasia. I guess one said it's like the words are like butterflies flying by, and you want to reach out and grab one, and you know which one you want to grab, but you can't do it. I thought that was an interesting visual analogy. The other one was visual too. They said it's like you're getting dressed in the morning and you see all your clothes and you know exactly what you want to wear, but you can't grab it off of the rack. Both of those were interesting, and it was interesting that they both described them visually.
Interesting. Yes, very interesting.
As opposed to saying, well, I guess they're having trouble with language, so maybe they couldn't say what I expected them to say because they had trouble putting that complex of a thought together. Like you said earlier, with Broca, it's a lot of time it's kind of staccato. It's like if you took a sentence, what was your sentence? I'm going to the movies.
Yes,
They would just say maybe going movies.
correct.
And I found that they'll point a lot. I don't know what they're pointing to. I have a family that I look out for, and he had a stroke recently, third one in the family. I started with one, and I'm now helping three of them. Anyway, he can't talk at all. He can make sounds. He kind of like grunts and such. So it's not a motor thing. And he was doing a lot of pointing. It was interesting because his pointing was fairly directive. He pointed like out of the house. He pointed up at the sky. I guess I've gotten okay at like talking to people that can't talk either with dysarthria or aphasia. And I figured out, okay, he wants to go somewhere. I said, you want to go somewhere, like maybe the store. And so, we did that. It was kind of like pointing charades.
The
We got
people with Broca's aphasia typically know what they want to say, they just can't find the words to say it.
That's interesting. So, of course, we can't go into their brain, but so those words are kind of, in a sense, running around their brain. They just can't get out.
Yes,
Well, that's what both my friend Hope and the other person were describing when they were talking about the butterflies and the clothes. They knew what they wanted. They were expressing the uh, that they knew what they wanted. It was inability to connect.
yes.
Okay. Well, anybody else got any questions?
So a couple of famous stroke survivors who had aphasia come to mind. One of them is General Michael Hayden. Um, I read his biography on Wikipedia, which doesn't, it does mention his stroke, and it says that he had aphasia. But then it also explains that he holds positions on a very large number of boards of directors of corporations, and he is a director of the U.S. Cyber Initiative. And I was asking myself, how on earth could he possibly be holding down these jobs if he can't talk? But it seems pretty clear that his aphasia was probably resolved to a large extent through speech therapy, because how else could he participate in
Excuse me for interrupting, but there are different types of aphasia. And when people say aphasia, oftentimes they just mean Broca's aphasia. But there's also Wernicke's aphasia and conduction aphasia. So there are other things that could have been affected other than Broca's aphasia.
Well, and I'm not a speech pathologist or an MD or even a neuroscientist. But I listened to my brother-in-law actually told me that he heard on NPR an interview with General Hayden, and I went and listened to it, and then I watched a short video on something else, and his wife, is it Janine? Something.
yeah, Janine.
His wife is often there, and sometimes it's interesting because he would like turn to her sometimes and she would fill in the blank, or he'd turn to her sometimes and it was almost like the words came to him and he would go on. Anyway, I said, hey, you know what? I'm gonna write to him. He might not even write back, or who knows, but if I don't ask him, I'll never know. So I wrote him, and he had the title of his NPR segment was I want to do more. So I wrote him a letter and I called it, you don't usually title a letter, but I titled this one right after Dear General Hayden, I want to help you do more. And I invited him to come on, and this week, I'm happy to say, I can officially announce it now. We're working on a date. He's agreed to come on one Tuesday, which should be fascinating. You know, part of it, of course, is like stroke impacts everybody from, you know, the general on a dozen boards to the, you know, janitor who cleans up the building that they meet in. You know, it cuts across all segments of life. So we haven't spoken or determined what the content will be. I've also invited Dr. Carolyn Falconer, who has been with us before, to be involved in that segment. She's also going to be involved in uh, a Tuesday meeting we have coming up in 2 weeks. I guess it's 2 weeks or 3 weeks, November 9th, 3 weeks, with a friend of mine, Carl McIntyre, who's an actor, the leading actor in the city of Charlotte, has a terrible stroke, gets left all day. He had it right after his wife went to work. Then she didn't come home for 10 hours. He lay on the floor, damage being done. And he had a terrible aphasia, and he managed to overcome it. He's now a motivational speaker and advocate for aphasia. And in order to do that, a group of, well, 140 of them, I probably knew 20 or 30 people in the Charlotte video and film production community came together and made a movie called Aphasia. The movie, Hope is a four-letter word, about Carl's journey. And so we're going to show the movie. Carl's going to appear as a guest and discuss anything anybody wants to. And I've asked Dr. Falconer to be there for that. And of course, Dr. Hetzler, you know her because you and she interacted when she came on about, you were asking about TAUB and whether constraint therapy in language. And
Yes, I remember that.
yeah, I do too, because she went, well, yes, I've had many conversations with Dr. Taub, and I'm thinking, wow, this is like the kind of stuff I want to be happening on Tuesday. We've got Dr. Hetzler and Dr. Falconer talking about Dr. Taub, but more important than that, you know, real stuff, stuff that, you know, we can use. So I guess aphasia is coming up on our, it's on our radar screen. We also next week have Mitchell Raymond, who's had a stroke at 6 and became a physical therapist, and he had to overcome aphasia. And I'm going to speak to him this week about the content, but there's been some suggestion from Rebecca that we also talk to him about overcoming his aphasia, because that was a major issue. You know, it's hard to go to college if you can't read or write or talk or understand, or some combination, not all four at once, of course. But any communication skills make getting a degree in physical therapy a whole lot more difficult. So he certainly had to overcome that. So we got three more, two more definite aphasia programs coming up, and one where we will probably talk to Mitchell about. I'll talk to him about his story, which is fascinating, overcome aphasia, and then, of course, I want to get into like what it's like to be a physical therapist working with stroke survivors, since he's a stroke survivor himself and he actually knows what he went through to get better. That's not something that every physical therapist knows about, thank goodness, because otherwise they would have had to have a stroke. So. Anybody else? I guess not. Well, I guess we should wrap this up. Uh, Dr. Hetzler, you and I need to put our heads together and see what else you could present on. I know you have one, you told me once you did a presentation at a assisted living center on maybe drug interactions or drugs in the brain. Everybody wanted to know about CBD and marijuana, so you went and made another presentation and went back there. So I know you got two more hanging out there that maybe we could get you to present on, or maybe there's some other subjects I don't know about that you would prefer to. But I guess the point of this is we love gaining knowledge from you and having you here, and we'll have you back anytime that you would like. And I would love it if you have time and see fit to participate in some of the things like General Hayden and Carl McIntyre, and I mentioned a couple of neuroscientists that MedRhythms has put in front of me, because I think there's some interesting discussion that goes on, like went on between you and Dr. Falconer when we talked about aphasia the first time. I can see you interacting with uh, both of those Harvard doctors at MedRhythms is suggesting I talk to you. I'm really interested in the guy that's a movement scientist and a physical therapist. Of course, the other guy was a PhD and an MD, so neither one of them are exactly slackers.
Well, thank you, Ralph. Yeah, I will try to uh, participate or be a viewer of these programs. They sound interesting. The other talks I've given recently in the past dealt with drugs in the brain. Got one on vaping and nicotine addiction, another on alcohol in the brain, medical marijuana, opioid use and dependency. Let's see, I think that's it. Although I taught a course on psychopharmacology, and that was all about drugs in the brain, so I could put together a talk on just about any psychoactive drug, probably.
Well, it might, you know, I guess our focus would be in terms of drugs. Let's say the drugs that typically stroke survivors end up taking. You know, things like blood thinners, muscle relaxers, uh, baclofen. Well, that's a muscle relaxer. Um, you know, the things that gabapentin, things that supposedly reduce pain. Um, uh, because that would be more practical than for a stroke survivor, of course, than nicotine or alcohol addiction, unless, of course, I'm sure we have some smokers and drinkers in the stroke survivor community. Um, but something on the drugs that are typically prescribed to us as stroke survivors would certainly be fascinating. Um, I won't press you. We can talk about it um, through email or offline. And it's, of course, only if you want to and you have time to. I'm just, I guess, in this wrapping it up, I'm just telling you that I appreciate you, and I think there are an awful lot of people that appreciate you and have benefited. Like I mentioned before we started recording, your presentation on neuroplasticity is about to hit 600 views. It had a serious impact on Rebecca and some other specific individuals that I know of, and I have no idea about the other 590, but I'm sure they got positive information from it. So would like to thank you for everything that you're doing to share your knowledge with the stroke community.
Well, thank you, Ralph. I think you're doing a fantastic job here, and I'd like to help you in any way I can.
Well, I appreciate that. Um, I guess we're actually, we're forming a 501c3, and we've had volunteers step up to the plate, and we're asking if anybody else wants to step up and help. We had a graphic artist volunteer this morning to help with the website. I've got this basic belief that together we've got more power than we do as a single voice. And I don't see the big organizations like American Heart Stroke rallying us together. They seem to be involved in the healthcare community, and we're kind of at the
Yes.
bottom of trickle down thing. And I want to kind of
Ex-
flip that pyramid because we pay the insurance companies. Why do we take the leftovers from them? And how do we bring science to stroke recovery? That's basically, and I actually need to specifically thank you for this. Where's Ken? He stopped showing up. And Ken for introducing us, because it was at a time when we were trying to figure out what to do with these meetings to make them more productive. And I also found, an OT that had a stroke, and you had a stroke, and I got interested in two things: the scientists and clinicians we need to talk to who have had strokes, and also the whole course of this Tuesday meeting took kind of a more scientific bent after your neuroplasticity, particularly your neuroplasticity presentation, because I realized that there's a lot of science out there that can be used in recovery, and we're not getting that information. We're floundering around in the dark, and um, of course, it's good to have at it as hard as you can, but it's better to have at it as hard as you can with some kind of scientific focus and behind you, because it can be a lot more productive. So that's kind of the course that I've been taking with this. I think survivor stories are great, and I'm going to let Mitch tell his, like I let Sherry Morant tell hers and Jenny tell hers. But at some point, if a show's nothing but, positive stroke survivor stories, you're not getting anything out of it. It might make you feel good, but you're not getting anything out of it that can help in your recovery. And that's kind of the focus that Stroke Buddies has taken, and the focus that this meeting has taken. And you played a large part in that, and that's as long of a thank you as my introductions usually are. But these are complex things, and that's the whole. That's the way it evolved. And so, thank you, Ken, and for introducing us, and thank you, Dr. Hetzler, for all your great presentations.
You're
Because
most
we're trying
welcome.
to bring science to stroke survivors. I never heard any of this in physical therapy or from a neurologist. You know, they answer questions. They don't tell you how to apply neuroplasticity to your recovery. Big difference.
the thing about stroke buddies that is so good is that we reject the idea that science is something that stroke survivors cannot understand. And once we accept that, moving forward with classes like the ones that we have on Tuesdays makes total sense to everybody. And it's a real service to the survivor community.
Well, thanks. And every one of us has been talked down, like the doctor that told me, we talked earlier before we recorded about one of the upcoming presenters was an expert in statins. Well, every time I ask about statins, I get treated like, well, just because he had a stroke, don't you bother your little brain. It's like they're talking to me like a woman. I hate to say that because we shouldn't talk down to women, but it's
Now
like,
you understand what it's like.
yeah, it's like, I'm sure you do. It's like, when they're telling me this, oh, well, because he had a stroke, it's like, I feel like, well, don't bother your pretty little self with these, big thinking issues. Just accept what I say, and we have a lot of people that are, well, we've had William Lowe on, follow up to your neuroplasticity thing, where he talks about some of the things as a OT student and a stroke survivor himself that he worked out in the studying of neuroplasticity. So there's a practical side to the scientific knowledge, and that's what I'm going to try and bring moving forward. And the whole partnership with MedRhythms is a great thing because, well, the two guys that they recommended are just 2 of the 7 or 8 that are on their advisory board. Now I'm getting invited to the advisory board meeting next Monday. And so, maybe I'm going to meet some more people that we can pick their brains. I'm always trying to pick everybody's brain, find out, what they know that that they can share, if albeit if it has to be through me, to impact recoveries. Because I got to believe that if you apply, I'm a big believer in science, and I got to believe if you apply a focused approach to your recovery as opposed to a more random or non-focused approach because you don't know anything, that you're going to get better faster. And I completely agree with Rebecca that, we're capable of understanding this stuff and we don't need to be talked down to. And I'm not saying in any way that you ever talk down to us, but we've all been talked down to by doctors and physical therapists and, oh, don't worry yourself with that. So that's
I think it's unfortunate that stroke survivors are often talked down to. And I think that might be in part because the doctors themselves do not understand it that well. So they're incapable of explaining it in more
Yeah.
simple terms.
right. Right. Or it's something they learned in medical school, but they never connected the dots with their practice. Um, I think that the whole thing about, well, you still have doctors, older doctors, saying the whole thing about, they're not real big believers in neuroplasticity because it didn't exist when they went to school. Now, you won't find a 25-year-old nurse telling you that. They'll tell you actually, and they have told me, the doctor's wrong about that because they have newer understanding. So there's a lot of factors at work. Insurance companies play a role in all this. And, the one thing that I think that we should be doing as a group, as a community, is exploring more science. And then eventually I'd like to take and have those same scientists and stroke survivors, physical therapists, occupational therapists who've had strokes. You wouldn't have to have had a stroke to participate in this, but eventually I would like to bring uh, continuing education back to the doctors and the physical therapists that present the perspective from our side as well. I wrote to Brian Harris recently, the CEO of MedRhythms. I said that I think we have something very much have something to contribute, but we don't have a seat at the table. So maybe we're going to change that. We're going to give it a try. It's just like recovery. You get nothing of what you don't try for. So maybe that's a good place to end this. I don't want to keep anybody. We got a little bit of a late start. And so I guess we'll see everybody next week with Mitchell Ray and any Tuesdays you can make it. And thank you to everybody out there on YouTube for watching. And we'll see everybody soon.
Thank you, Ralph.
Thank you.
Thank you.